Hello and Assalamu alaikum. Ultrascan Diagnostics. Say this is the CBCT of the patient that you had requested. The area of interest is the upper left 4 and 5 region for implant placement. Sorry. Now starting with the upper left 4, you can very clearly see we've got an extracted socket here. Very thin ridge. This ridge is not very thick. We've got a ridge width of just 6 millimeters and a height of 16 millimeters. Moving to the region of the 5, the 5 is a grossly carious tooth. You can see that the carious nature of the tooth is quite significant. Most of the crown structure on the buccal as well as on the distal as well as on the mesial aspect is grossly carious. This tooth does not have sufficient tooth structure for a post and core and has an endodontic infection as well. If this tooth is extracted, we've got 10 millimeters of ridge width with approximately 14 millimeters of height. Now let's take you to the axial view of the top to bottom view. Apologies, and there you go. Let's go there, and here you will be able to see this is the left hand side, and you can see very clearly as we're moving down. This is the crown structure, but as we move you can see that there is a carious tooth on the carious part of the tooth here, and then there's caries here. So essentially most of the tooth is grossly carious and will not be able to withstand occlusal forces. So hence our advice, we have mentioned the situation of the tooth, and we've also mentioned how this tooth, even though we feel like there might be some either graft material or bone material, there is loss of buccal plate, so the doctor might have to reconstruct the entire buccal plate. Thank you very much.